The hospitals are trying their best, but when the community isn't responding, that's really tough. It's really tough on the healthcare workers.
Scripps Health Chief Medical Officer Dr. Ghazala Sharif says as of Tuesday, their hospitals have 312 COVID positive patients. Now, compared to this time last year, Scripps had more than 500, but numbers are continuing to increase, and it's unclear when things could slow down.
Last time we peaked on January 8th, that was when all the restrictions were in place. We don't have that right now. So right now we're climbing on the hospitalizations, and everybody's still out doing the social activities, not distancing, not wearing their mask. And so it's so highly infectious, twice as infectious as Delta. And so this may just keep going for a while unless we really just pull back a little.
There are nearly 1,100 San Diegans hospitalized countywide with the virus. That's compared to nearly 1,800 this time last year.
Our, numbers are now only second to the surge that we had back in early 2021.
Sharp Healthcare Chief Operating Officer Brett McLean says his modeling shows a potential hospitalization peak in about 10 days.
But, I heard someone say once, all models are great, but none of them are correct.
Even though hospitalizations are not as high as they were a year ago, this surge is particularly difficult because hundreds of healthcare workers are out with COVID. To help relieve some of that, the state recently issued guidance allowing staff who have tested positive and are asymptomatic to return to work right away, something that not everyone agrees with.
We don't support that.
Very disturbed by that announcement that went out, bringing people back on day one. Even if they're asymptomatic, still means that they can infect others.
Healthcare systems are having to cancel and delay some procedures, but both Sharif and McLean hope that the state does not opt to cancel all elective surgeries.
We are managing literally on a day-to-day basis the cases that we can keep going. On the ambulatory side, we're trying to keep those going so we don't delay care. We had a patient last surge who was the only sole driver in the household. He was delayed for his cataract surgery. And, that really limits people. So we don't want to cut back on that if we have to.
Sharif says 80% of the Scripps patients are unvaccinated, and no one who has gotten their booster shot is currently in the intensive care unit. Matt Hoffman, KPBS News.